Hello everyone, and welcome to this overview, hopefully of this of this of works in relating regarding to the investigation of central mechanistics of coping in pediatrics on young people with chronic kidney disease or CKD. This presentation, this overview, is on behalf of the Renal Patient Support Group, the RPSG, the Kidney Disease and Renal Support Group, or KDARs group for kids, and on behalf as part of the annual meeting for the European for the joint meeting, the joint annual meeting between the European Society for Pediatric Nephrology and the European Working Group on the psychosocial aspects for psychosocial aspects for children and young people suffering with chronic kidney disease or CKD. Um, so to begin with a little bit of introduction to this works. So present data available sort of support the basis or claim that children and young people with chronic disease have access to a broad selection of coping strategies. One limitation of most investigations, however, is that coping data have lacked situational detail. This limits contextualization surrounding how young people deal with different triggers or in around different stress or different triggers, different sort of stress triggers, etc. And there is data to indicate at the same time that coping strategies play an important role in the way individuals respond or react to negative or situations and life events. And during the 1970s and around the 1980s, research surrounding coping had moved towards a theory and that primarily referred to conscious primarily that refers to conscious processes. And so over the past decade or so now, there have been considerable theoretical and practical intrigues surrounding coping strategies. Now, looking a little bit in around CKD epidemiology, and I've done my best here to focus the epidemiology in around the pediatric young people population, a pediatric and young population, since much of the literature that exists that sort of exists is sort of sort of is sort of over sort of over sort of as over is in an over is in an over where the adult population is concerned in around particular particular diseases and particular and specific conditions. So the prevalence of CKD in children or chronic kidney disease in children and young people is higher at about 90 per million age-related population, or PMARP, in the United Kingdom. However, uncertainties also exist about geographical area covered. To iterate or to inform at the same time in publication, in some works and publications, in around 2012. In around 2012, a particular literature review had informed that at that time, in around 2012, or in run up to in around 2012, the prevalence for CKD in children and young people was in around 7 to 8 per a million age related population, or PAMRAP, in around in the United Kingdom, in the United Kingdom, or in the UK, in context across where data where epidemiological data existed in context of the 13 different the 13 different specialist hospitals that collated data for and in around pediatrics, young people suffering with varying forms of chronic kidney disease. At the same time, a low prevalence of CKD stages 3 through 5 exist or have been identified, wherein epidemiological data had informed that 30 PAMRAP was found in Japan, in a Japanese population, but a survey across the country had incomplete reporting of pediatric and young people CKD cases, or chronic kidney disease cases aged less than 15, less than those who are less sorry those from the pediatric young people population at age less than 15 years. 15 years of age, and in a Kuwait population, there was also a high prevalence of CKD of 330 per million age related population, which was reported in children or young people with a glomerular filtration rate of less than 50 ml per min per 1.73 meters squared between 96 and 2003, suggesting CKD, suggesting CKD, a chronic kidney disease, but where CKD or chronic kidney disease has specific and particular genetic predispositions. So at the same time, published works pertaining to the evidence-based strategies relating to coping in young people population, again, amongst the young people population, children or young people population has been evidenced as being sort of a limited amongst the general publications that document in around CKD or chronic kidney disease. The development in all children and young people with a chronic illness can be best understood at the same time in context of expectations surrounding cognitive and social and emotional development. Coping with chronic disease also has been a major research area in the adult population in more recent years, and fewer efforts again have been made understanding coping in children and young people, so in amongst other sort of chronic healthcare conditions, and amongst other chronic healthcare conditions. And the study of coping with chronic disease or diseases in children and young people is also unique and challenging, because there can be contradictory views about causes, etiologies, the treatments surrounding illness and illnesses, and strategies. And so I'm now looking at sort of theories and sort of modalities or models in regard to where literature has documented and evidenced sort of coping and stress from as early as the early 1900s. So Walter Cannon had developed the fight or flight sort of theory, in around 1929, and the theory was primarily was a physiological theory, sort of a physiological theory, or from a physiological basis, and then in around 1936, works by Hans Selye had developed the general adaptation syndrome, where the theory and the model was from a physiological basis, and then works by Moose and Solomon had developed the emotion, stress, and central nervous system and immunity sort of theory in around between 1964 and 1969, and where Moose and Solomon's theory was from a physiological sort of basis, and then in around 1966, theory from Richard Lazarus in around the harm, threat, and challenge. In around harm, threat, and challenge had been developed, which had a basis in around the psychological, sort of psychological basis as a theory, and then George Engel George Engel had developed a biopsychosocial model, a biopsychosocial model of theory in around 1977. George Engel's theory and model is and has been a basis for sort of works in and around general sort of aspects of general medicine, in around general medicines, where George Engel had developed theory in line to a sort of holistic basis that link physiological and psychological basis. And then Susan Folkman developed a positive emotions theory in around between 1980 up to 97, and where the theory and the works was from a psychological basis, and then following where where theories had developed in around the psychoneuroimmunology or PNI concept and the diathesis stress model, which are theories and bases that much like the works of George Engel from 1977, are theories and bases that link psychological and physiological sort of theories in sort of unison, in context, so in unison. And on the right of this theory, on the right of this on this overview here, there are some citations, so listeners and viewers are welcome to check out some of the sort of the works that sort of document these sort of theories and modalities, for sort of cross referencing. And now looking at sort of looking at coping corollary. So national estimates of prevalence of childhood or a childhood young people chronic illnesses. So for example, prolonged chronic illness or disability or disability that interferes with daily functioning indicate indicate that in around just over 30% of children and young people under the age of 18 years have one or more chronic illness or illnesses. However, the recurring symptoms of end-stage kidney disease or ESKD lead to abnormal challenges abnormal challenges. So, for example, in around hospitalization and or invasive medical procedures, which result in periodical adjustments for chronically ill young people populations. Now, looking in this slide or this sort of overview here, looking at sort of a sort of a coping criteria, a sort of coping criteria that had been initially developed between 2009 to 2011, and where this coping criteria is and have been sort of specific for children and young people through CK going through suffering with varying forms of CKD, chronic kidney disease, and in around CKD stages four and five, but through suffering with CKD stages 4 and 5, but also where the coping criteria can be sort of adapted, if you like, in and for young people in CKD stages 1 through 5. So these are again the six A's for coping criteria, which look at initially to acknowledge, secondly to accept, thirdly to adapt, fourthly in around maintaining in around maintaining a sort of a healthy and a sort of a fighting sort of attitude, and then fifthly in around asking questions, and then sixthly in around active, in around where children and young people living through and going through various forms of chronic kidney disease. CKD is where they are, as part of this coping criteria, active forms the sort of latter aspect or latter part of the coping criteria. So some conclusions then. There is no formal, so at present, and in amongst the literature and amongst guidances where kidney disease or chronic kidney disease is concerned, amongst the pediatric nephrology and pediatric young people population, there is no formal coping framework for children or young people suffering with CKD or chronic kidney disease. Several models and theories can help to provide insight. There needs to be a coping or stress framework outlining coping for young people, and such work requires insights from a psychological and physiological sort of standpoint, encapsulating practices from clinical to scientific research to psychological and psychosocial evidences. So additionally to highlight here that a bit to read and sort of refer and reread the works in around Walter Cannon, Hans Selye, George Solomon, Rudolf Moose, Lazarus's Harm and Threat Challenge, Threat and Challenge, and George Engel's biopsychosocial model, Folkman's positive emotions, and then literature surrounding the diathesis stress model and in around the psychoneuroimmunology concept. Just here on this page, on this sort of slide, is a list of references, sort of summarized, summarized sort of references that listeners and viewers can and refer to identify works in around the sort of the presented works here as part of this overview, looking at coping in young people in amongst those suffering with different forms of chronic kidney disease or CKD.